And Susi Tegen is the Chief Executive of the National Rural Health Alliance and joins us now. Susi, how could this fund help improve access to healthcare in the bush? Are there some examples that are tangible that you can give us?
Oh, look, this is a fantastic initiative. We're really pleased about the release of this information. 2/3 of Australia's income comes from rural, remote and regional Australia, and 50% of the tourism income, despite the fact that they are only 30% of the population. And this sort of funding is about time. We have not had people looking after rural, remote and regional Australia. They are the economic powerhouse for Australia, and they have had to do without for so long. Local government and communities will benefit from such a fund. We know that many local governments and communities are having to raise hundreds of thousands of dollars to ensure that they can keep their health and medical workforce, that they can keep the local educators, and there is an opportunity for housing for medical and health students, allied health students. There's also funding for those clinics to expand and work in other regions in the area, and it'll also be able to be allocated to childcare, which is one of the biggest issues for those frontline workers. And so it is just a positive. It's my birthday today, and this was just a wonderful way to wake up this morning. It's about time that rural, remote and regional Australia is looked after. They make up 7.3 million people and they've been left behind. And they're dealing with droughts, floods and fires. This infrastructure funding is something that we've all been asking for. And rural, remote and regional Australia deserves this and more.
Well, Susi, a happy birthday to you. Give us a sense of what you're hearing from regional, remote and rural Australia about the state of healthcare and, in fact, childcare, and some of the experiences that you're hearing. Because I was in Tennant Creek a couple of months ago at the end of last year where I grew up, and the thing that I kept hearing was about how the infrastructure needed work. There was difficulties getting and holding on to doctors and nurses and health professionals right across the board, which then has a flow-on effect to the way that primary health care is delivered.
Well, I can't understand why we expect rural communities that are bringing in all of that income for the rest of Australia to enjoy and have kept us out of 2 financial crises, is expected to raise funds after they've paid their taxes, they've paid their Medicare levy, they work in the industries that are bringing in the money for the rest of Australia, and yet they're expected to do more capital raising, more fundraising so that they get the basic services. Currently, there is a $6.55 billion underspend of healthcare in rural Australia compared to the city. So if you live out of the city, you're getting $850 less health expenditure than you are if you live in the city. Now, we're an equitable country. Rural Australia is not a third world country, and so we need to start treating people equitably. And healthcare is crucial, because if healthcare fails, you can't have industry, you can't have education. So those communities are working together with industry, they're working together with the healthcare workforce, and they are, they're pulling their hair out, they are stressed and stretched, and then they're being told that they need to be resilient. I mean, it's just a joke. And so this funding is going to be amazing. So I'm really hoping that all sides of Parliament, and we don't care whom we work with at the National Rural Health Alliance, but we hope that all parties and all politicians start looking after their cousins, aunts, uncles and parents that live in rural, remote and regional Australia, because they deserve the same healthcare access, the same childcare access and the same education access that people in the city do. And this is about equity and it's about parity.
How would you expect this fund to work? Because one of the big challenges would have to be prioritising the level of need across many different parts of the nation.
True, but you know, we've got communities that are already working with local industry, with the education system, the health system, and they're all sitting around the table. I mean, I look at communities such as Mareeba up in Queensland, Kimber in South Australia, and Bogan Shire in New South Wales, and they're sitting around the table trying to prioritise what the need is for their communities. And anyone saying that, oh, you know, they're going to take everything for granted and they're going to rip the system off, they're not receiving enough money at the moment. They're not even receiving equitable funding. So don't make them jump through hoops. Don't make them justify why they deserve it when they're not even receiving equitable funding in the first place. And so they are very good at working together. They don't have to work separately like you do in the city, because in the city you can afford to work separately. These communities are driven, are positive, they're focused, and they know what their needs are. And, you know, I can see the funding being prioritised in those communities, and then they will go through a process of being able to access childcare or growing a clinic or providing accommodation for medical and health students, because at the moment they can't get that. I mean, I had one medical student tell me the other day that there was no accommodation where they want to train for the next year, and so they had to leave their family in the city despite the fact that they wanted to work in rural Australia because there was no accommodation available. Now, paying $40,000 rent in the city for his family and then having to pay extra rent in the country, it doesn't make sense. No wonder people don't want to go there. And so this really makes sense. It's a really positive move, and I'm hoping it's the start of many other initiatives, because rural, remote and regional Australia has been forgotten, and it's about time they start being recognised for the great powerhouse that they are.
And just finally, what's to prevent this money from being used for pork barrelling in coalition seats like we saw with sports rorts?
Oh my God. I mean, why do we straight away start looking at the negative of everything? You know, I was saying before, there is an underfunding of rural Australia in the first place. Rural Australia has not had any initiatives from any sides in this debate leading up to the election. It's about time you start funding rural Australia, and it's about time that we continue to fund rural Australia, because they don't have enough votes in those regions. And I was told recently by a politician, oh, there aren't enough votes in the country. Well, you know what? These people, we rely on these people to bring in Australia's economic wealth. Let's just think about how we can support them to do better. If rural Australia were a company and 30% of your company was bringing in 2/3 of the Australian export income and 50% of the tourism income and 90% of the food Australians eat, I would throw all my money at them, because we want them to do well for the rest of Australia.
Susi Tegen, Chief Executive of the National Rural Health Alliance, thanks for your company this morning.
Thank you.